Good morning, everyone, and welcome to the 2021 Climate, Health, and Equity Symposium.
It is now my pleasure to introduce to you a living legend, Dr. Robert Bullard, who is known as the father of environmental justice.
Zip code is still the most potent predictor of health and well-being. Neighborhoods that are polluted, where America is segregated by race and economics, pollution is also segregated in those areas. That's why our climate plans, our environmental plans, our energy plans, our health plans must build equity and justice into those plans.
With us today to discuss the impacts of heat stress on mental health is Dr. Ron Bailey.
Issues regarding heat and thermoregulation alteration are substantially important in mental health and in treatment of psychiatric patients. As heat change occurs, our patients are going to be at much more risk, and our responsibility to manage them, I think, are going to grow. And I think the heat index rise has precipitated that problem and worsened.
We need to be advocates for addressing climate-induced health risks.
When we're coming up with solutions for these populations, we should do it with the most vulnerable populations in mind.
Now, Dr. Virginia Kane will speak to us about COVID.
One of the key things is from our federal, state, and then to our local level, it's all about the science. Culture climate makes a difference. And this is the time now, from a prevention standpoint, to put those things in place to help lessen the burden from infectious diseases.
Our final speaker in our panel is Dr. Edith Mitchell about cancer.
To keep decreasing the incidence rates for cancers in African Americans, we need to control climate change.
Let's address both and cut down on the morbidity and mortality associated with these diseases.
As you know, children deserve every opportunity to reach their life's full potential, but climate change puts their health at risk. We have seen more climate change in the last few decades than was evident in over the last 650 centuries. We must aim our resources and focus on protecting the planet we now have as our responsibility. We therefore must implement solutions to mitigate negative climate change, and this will in turn grow our economy.
We have the best opportunity yet now with this administration to recognize that prevention by far is the best approach to protecting health. Do you know for every $1 in investment in addressing climate change, you save $35 per person in population health expenditures?
Now we're going to bring up Dr. Randall Morgan, who is going to talk to you about the Cobb Scholars Program.
But Dr. Valentine recognized the possibility that the Cobb Institute could be instrumental in increasing the numbers of underrepresented minority scientists who would eventually, and with appropriate mentoring, become strong candidates for NIH funding at the highest levels.
SHLI definitely situated itself in the environmental justice movement, environmental health determinant in terms of mitigating some of those determinants, and the climate crises that is impacting vulnerable communities.
We are going to transition into our fourth and final panel of the day, and I am happy to introduce the panel moderator, Melissa Baldwin.
So at Florida Clinicians for Climate Action, we believe that clinicians have a significant role to play in addressing the global climate crisis. But why clinicians? Well, the reason is because research consistently shows that people trust nurses and doctors more than any other profession. Climate change is harming our health now. It's going to get worse if we do nothing, but the good news is that there's hope because climate solutions are health solutions.
Heat continues to be the #1 weather-related killer in the United States. On average, every year, there's about 154 days with a heat index above 90 degrees. By mid-century, that number will be about 181, almost half the year. So we know this is going to impact wide sectors of our community.
Today, I'm excited to speak with you about our work on extreme heat. Our research finds that increases in potentially lethal heat driven by climate change will affect every state in the contiguous United States in the decades ahead. We know that but all heat deaths and illness are preventable with the right protections in place. The actions we take must protect people now and prevent the worst case scenarios from becoming reality.
It is time for all of us to speak up, show up, and stand up.
The old style tactics simply aren't working anymore, increasingly in a society where we're politically polarized.
So we have to find ways to get allies in the business world that have to start acting now. You have an opportunity to educate, advocate, engage, and make a change. Because if we don't help the vulnerable populations, we're going to have unnecessary deaths, and this is unjust. And if we're going to make the changes and reduce the disparities and save our communities, we must act now, because climate change is real, it's happening now, and we are going to have to do more if we're going to protect ourselves, our neighbors, our children, and our grandchildren.